Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Fastest back pain relief if bending forward hurts. So you're saying if someone has pain when they bend forward.
Right, if you do this and this clearly makes it worse, or you know that hurts, or sitting, tying your shoes, if that consistently...
Kind of all in that same thing, right?
Right.
Bending the back.
Bending the back forward.
This way, bending the back this way.
If that makes your pain worse, that's what this video is going to help you understand and be successful at becoming pain-free. So, I just want to mention, Bob, I just had this happen last week. I was so excited. I wanted to share this with everyone in the world here.
Glad that you are.
I had a patient come in. He had all the symptoms. He couldn't do his lawn work. He couldn't sit down very long. Even brushing his teeth, bending forward, back pain. I showed him 2 or 3 little exercises and one other treatment, very simple. The next week he came in, he says, I don't need to see you anymore.
Yep.
And things were fixed.
That's what you want to see.
Right.
I mean, we live on gratitude.
Right.
So,
but before we go any further.
Yeah, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also go over to the Facebook and like us, Bob and Brad, because all this week, once again, we're giving out positive vibes to those of you who like us.
Yes.
So, do you feeling this?
All right.
All right.
So, things that I want to...
So this guy, other things, I mean, sometimes bending forward, making the bed, vacuuming, sweeping, all these things that...
Precisely.
I wanted to add to that.
Yeah, no, that's good. That's good. So we call that flexed forward posture in the therapy, or in the physical therapy world. So that just means this posture. If that hurts it, again, sitting.
Yeah, especially with bad posture, but also, and remember, sitting includes the vehicle.
Right.
Because you're slouched in that vehicle for a long period of time.
Oftentimes I have people sitting in their recliner, a soft, cushy, soft
couch or recliner.
Right. All those things increase your back pain. Hard to get up from there. It's like, oh, it really hurts to get up, but once you get moving around, it starts to feel a little bit better. That's another key that this treatment's going to help.
Feels better walking.
Right.
A lot of times.
Oftentimes better walking. Oftentimes, I should say, going back like this is painful, or you feel like you're locked up doing that.
Yeah.
Then this is more than likely going to help you out. So what do you say, Bob? Should we show them the exercise?
Yeah, I would say, by the way, because this was based on a lot of the work of McKenzie, and he said when that's the case, when they fit all those criteria, 80% of the people respond very well to this.
Right.
So
that's very good.
That's a high percentage.
And we've been treating, 50 years between the two of us, and
we've seen this.
We agree completely.
Many times, right.
So there you go. So should we talk about sitting posture first? Because oftentimes this is a key. I've had people just changing their posture like this, taking care of well over 50% of their pain.
Sure.
So we're going to use lumbar support. First of all, stop sitting in those soft sofas and those furnitures and the car seat that promotes poor posture, rounds your back out.
Rounded out posture. What we're trying to do is get you back to a straight posture, which is, an S curve basically. You have a curve going in the low back. You kind of have an arch going in, then you have the arch going out, and an arch going in. Kind of an S.
So we're going to use lumbar support. I'll keep this here, Bob, for a second. And you can see where you have a lumbar support. It pushes on that low lumbar spine to help maintain that curve that we were just talking about. So
if you're on the couch, by the way, and you feel like you have to, you can take a throw pillow. Times, or in the recliner.
Right.
And that's what I do. Yep. I just put it in there, and it just fills in that gap.
If you don't have a lumbar support purchase, you really don't, sometimes you don't really need to. You can use a throw pillow. You could take a towel roll like this, and you're going to put that here, and you'll notice it. As soon as you lean into it, you say, oh, boy, that feels like good support. This is a key.
A lot of times we recommend starting with the towel because then you can figure out how thick it needs to be. Because for some people, they like less thickness.
Right.
And some people who are in the throes of back pain really like quite a larger roll.
Right.
So like this one is quite large, actually.
Right. And they make 10, 20 different
Yeah.
sizes and styles of a lumbar support. We have people always ask us, we're just talking about someone that wants to show us,
Yeah.
have us show theirs lumbar support. But a towel will give you an indication you need a small one or a bigger one. And if you want to stick with a towel, works good. That's
Sure.
great.
You got to show your favorite one.
Right. Now,
So it's a memory foam
this
right?
one is a real broad one made out of memory foam. And we were discussing this. This one, I've used these. They kind of help, but this one for me makes a big difference, and it works great. I got spondylolisthesis with a little bit of stenosis, and I have a feeling if you have that, you're going to use this. However, if you've got either one of those, bending forward usually feels better.
Right.
So they're out of that category.
Yeah, they're not,
You're probably not going to use this one if you fit what we were just talking about.
Right.
But we like
Okay.
it.
Yeah.
So here are just a few different styles of lumbar supports you can
That
use.
one's air-filled one.
Yep, air-filled one. You can vary how thick it is. Fits in there nicely. There's round ones. This one's, I think, about a medium. They make bigger ones. Again, if you're-
Denser ones. Yeah.
Yeah.
Less dense.
It all depends on your body size. If you're a large person or a skinny person, the chair you're sitting on.
It's too bad they don't have a store you can go to. I don't know. Remember they used to have those relax the back stores? I bet you could try them there. But I
You
don't
have
know
a
if they
variety of them.
Yeah.
You sit down, and then you know you're getting
Yeah.
the one you want
I don't know if they
without.
still have those stores.
Maybe we should open one, Bob.
Someone comment below. Yeah, really.
All right. So take care of your sitting posture. You'll know if you're doing the right
Before
thing.
you do that, Brad, let's go. When we go into the exercise, one thing I
sure.
want to show is
Yep.
that basically, because we're going to talk about the exercise now.
Yeah, the exercise.
So basically, you're in a flex position like this. What we have found, not what we have found, what's been discovered
Right.
is that by taking your body in the opposite direction into extension, you actually decrease the pain and treat the issue.
Right.
So we won't go into what we think is going on, but so we want to get your back going the other way.
Right.
So
Yeah,
we
this
can do
is-
that a number of ways.
There's been a lot of studies done on this system, and they've been showing good results with it. So,
Do you want me to show?
yeah,
this
go
first?
ahead, Bob. You're good at this one.
Well, you're going to start off, again, my body was back was in the flex position, so now I'm trying to put it into the extended position.
Right.
And you can start off just by going up onto your elbows here like this, and even start a few press ups. This, like Brad mentioned earlier, it could hurt a little bit to start off with.
Right.
But as you do repetitions, it should start to feel better.
Right. Now, if you're like this and you're unable to stand up straight and it's very uncomfortable, you may have to start by putting a pillow underneath your stomach.
Yeah, if you're really flexed, and maybe even two,
Right.
and work your way out of the pillows to the point where you get to this starting point
Right.
here.
And this may take a few days, possibly, depending on how severe it is and how
Or
you're
it may
working
go
it.
day one.
Yep. I've had it both ways in the clinic.
So your gentleman probably did day one, I suppose, because he said
Oh.
he came back a couple days later and was already better.
Right, yeah, his responded very well.
So, and then you want to work to the point where you get your hands underneath your shoulders and you're going to start pressing up like this. You want to make sure you're not lifting your pelvis
Yeah,
up
right
like
here.
this. You're working the back, not the pelvis here.
There.
So you're trying to get extension. And you want to keep working at it. And you'll find out over time that eventually, hopefully, you can get all the way up to the arms
Right.
extended and the pelvis still stays down.
Right.
So then that's usually where the magic happens.
Yep.
Mackenzie used to say. That's where the pain relief usually occurs.
Now, as far as repetitions, you'll do maybe 10 of these at a time, and you might take a break and do another set of 10, and then give it a break, come back to it, an hour or two later, and continue to work with
But
it.
you can do it frequently.
Sure.
You can do it every hour. You can do it 5 to 8 times a day.
Right.
So
yeah,
that's usually what's recommended. Again, as long as it feels good,
right.
you're not getting increased pain. You're not getting pain going down the leg either.
Right, precisely. Now, when that starts to get better laying down, then most always this range of motion starts to come back, and you're not feeling like you have to be flexed. You can feel more comfortable in the upright position, and then you start bending backwards this way, standing. And you may want to take a belt, a towel roll. Here I've got the stretch out strap, which works good because you don't have to have such a grip strength, and you can get more specific.
So you said you sent a belt with the gentleman?
Yeah, I did. I gave him a gait belt, actually. I've had
To use laying down or to use standing up?
standing.
Standing,
Yep.
okay.
He could start standing already, and he said, boy, he could get it right where it felt good, and he would stretch it like this and like this. And that's what he's going to do For maintenance.
For maintenance, yeah.
Yeah, from now, anytime he does work or throughout the day, this is just.
And that's what we recommend. Like if you do a heavy lift of something, make sure that, you know, right after you get done with the lift, go ahead and go back the opposite way. You see pregnant women doing this, you know, they're giving themselves a stretch naturally.
Right.
Because they got the weight pulling them forward, so.
And you can actually, if you're going to do some lifting or some sitting, you may want to extend backwards prior to that. If you're going to go on a car ride for a couple hours, you know, use your lumbar support, but stretch out before you get in the car and, you know, getting out.
You got a beer belly? Probably want to go ahead and do some of these because the beer belly's pulling you forward.
Bob, in Wisconsin.
Wisconsin,
yeah.
That's like the national.
Oh, yeah, we're experts over there
on the beer belly situation. So.
All right, well, very good. So that's going to really help a lot of people with these symptoms. So once again, Bob.
Give it a go.
But Bob, what about, this is another step towards.
We can fix just about anything
except
a broken heart.
There you go.
But we're working on it.